And we're now heading into our fifth panel of the day, where we'll be discussing the pandemic and mental health, a focus on women and small business. Here to moderate it and to introduce our panelists is LEAH Nord, Senior Director of Workforce Strategies and Inclusive Growth with the Canadian Chamber of Commerce. LEAH, this is a huge issue, and I know that a lot of people are really anticipating the conversation that you're about to have. So the floor is yours.
Thank you very much, Catherine. And if we were all live here this afternoon, I would be asking everyone to give you a round of applause to thank you for taking us through the day. And good afternoon to everyone. I think I can firmly now say across the country, we're at different stages of afternoon, but firmly planted in the afternoon, even on the West Coast. I'm coming to you today from Ottawa, which is the traditional unceded territory of the Algonquin Anishinaabe peoples. And we at the Chamber, me at the Chamber, have been saying many times throughout this crisis where the pandemic has been first and foremost a health and safety crisis, with an economic crisis more or less in tandem with that. The third wave of crisis sweeping across the country and affecting all Canadians is that of mental health. It's an issue that's been touched on here throughout the day, I think in every panel and every conversation, but looking really forward to touching, to focusing on this in this panel and really drilling down on this important issue. It is my distinct pleasure to be moderating this panel and this discussion. And it's not only about mental health, it's going to have that lens on gender and small business, because again, there's been disproportional effects. I have any number of stats, but I think they're all coming from the Mental Health Commission. So I'm not going to upstage Michelle here this afternoon. We are also most fortunate in having such a diverse and distinguished group of panelists with us here today. Folks, what I'm going to do is invite them each to the stage in turn. I will introduce them as they come to the stage. We'll give them each a chance to speak, and then we will open the floor to questions. So first off, to start our panel discussions today, it's a pleasure for me to introduce MICHEL Rodrigue, who is the President and Chief Executive of the Mental Health Commission of Canada. He joined the MHCC in 2015, bringing a wealth of management experience and a unique mix of expertise in performance management, stakeholder relations, finance, and accounting, and communications. He is driven by his commitment to the principle of mental health for all, where people have equitable access to recovery-oriented, evidence-based, culturally adapted mental health care where and when it is needed. Before joining the Commission, MICHEL enjoyed a wide-ranging career in management consulting and public affairs, serving as the CIO of the Professional Institute of the Public Service of Canada, press secretary to the Premier of Ontario, and as president of several independent firms. MICHEL, I congratulate you on your recent appointment as president and CEO of the MHCC, and I ask you to take the floor. Thank you.
Thank you so much, LEAH, for that introduction. Thank you. Good afternoon, everyone. I am truly honored to be speaking with you today about a topic that's really taken on a new meaning in the wake of COVID-19, supporting the mental wellness of women in the workplace. At the Mental Health Commission of Canada, it happens that the majority of our staff are women. When the pandemic hit, the ensuing fear and uncertainty certainly affected all of us in different ways, but the practical and logistical implications were certainly not equal. For many women, who are already statistically more likely to manage household and caregiving responsibilities, the changing reality created an impossible juggling act. Over the past 16 months, we've heard from countless members of our staff who are trying to manage an unthinkable number of tasks. Women were caring for older relatives, too vulnerable to even get groceries. They were assuming the role of homeschool teacher or daycare provider to young children, all the while adapting to a virtual office environment. As employers, we need to recognize that these realities and the mental health ramifications and cannot be dismissed. Earlier this year, the MHCC and the Canadian Centre on Substance Use and Addiction commissioned a series of LEAH polls to really better understand the pandemic's impact on mental health and wellness. One of the clear messages that emerged from that polling was that the mental health impact of COVID-19 has not been felt equally. And women, as it's been said before, are among those disproportionately affected. From the polling, we were able to determine women reported higher rates of anxiety and poorer overall mental health than men. The differences were even more pronounced in households with children under 13, with those women reporting higher rates of substance use than their male counterparts. So, what's at play, and what can we do about it as employers? For one thing, women are more likely to work in industries that have been hard hit by the pandemic, such as retail and hospitality. Estimates are that about 500,000 women in Canada are now unemployed because of the pandemic. Additionally, many women have had to leave the workforce due to the increased caregiving responsibilities, especially those with young children. For those of us whose organizations are fortunate enough to continue to operate during the pandemic, there are actions that we can take to better support our female colleagues and employees, including those returning to the workforce. This past spring, the MHCC developed 2 resources to support women sidelined from the workforce during COVID-19, all developed by women for women. One with guidance for employers, the other aimed at the women themselves. Both guides underscore the value of putting mental wellness first, regardless of which side of the payroll you're on. For employers, that could mean things like redistributing workloads, adapting work schedules, relaxing rather rigid policies, understanding that the competing demands are largely outside of her control, and most importantly, showing empathy and compassion. Now more than ever, fostering a healthy work environment requires flexibility, which can take many different forms. For example, some of our staff are most productive when their small children are sleeping, so they work hard over nap time and after bedtime without the need to feel guilty about being unavailable during certain parts of the day. Here, I want to emphasize the Mental Health Commission of Canada is an employer like any other. We actually don't have a magic spell or a magic wand to make our employees' mental health challenges easier to manage. We can't protect them from the pandemic. We've had to build in the work to build a foundation for psychological safety that puts mental wellness at the heart of our operations. What did put us ahead of the curve when the pandemic struck was that we had adopted the national standard of Canada for psychological health and safety in the workplace, a framework we have championed for many years. The standard helps organizations understand that the mental health at work isn't about a single policy or a one-off presentation. It's about embedding mental wellness perspectives across the board. It means sometimes delving into psychosocial factors, continually looking at ways to improve, and ensuring employees understand their connection to the organization's mission. It means training managers to recognize signs of mental distress and equip them with the tools to confidently address them. The Working Mind is a great example of this kind of training, and now it's offered virtually. The evidence-based program was developed to shift the way employees and employers think about and feel about mental health by addressing barriers to care, reducing stigma, and strengthening personal resilience. There's also a version designed specifically for managers who may be unsure to how to have those important mental health conversations with their staff or properly supporting a return to work situation after a mental health leave. It's worth mentioning that these types of training programs and initiatives aren't just invaluable tools to create a psychologically safe culture at work. They are sound financial investments. Before the pandemic, mental health conditions were associated with 30% of disability claims, and roughly 500 people in Canada were missing work. 500,000 people in Canada were missing work every single week due to a mental health condition, costing employers nearly $20 billion a year in Canada alone. Further, a study by Deloitte, which looked at the return on investment on workplace mental health programs, found that companies whose program had been in place for 3 years or more had a median yearly ROI of $2.18 for every dollar investment. So an ROI of $2.18 for every dollar invested. So it's not only the right thing to do, it's the right thing to do for the bottom line or for being an efficient and effective workplace. As the saying goes, actions speak louder than words. The same is true of promoting mental health in the workplace. It's not enough to tell employees that you care about their well-being. As employers, we must show them. Investing in evidence-based programs and initiatives offers flexibility and finding new and creative ways to alleviate the many burdens employees are carrying will all pay dividends in the future, long after the pandemic is behind us. So, as we move towards recovery from this pandemic, we have a real opportunity to come back stronger and better than we were before by taking stock of the lessons we've learned and putting mental wellness first. We can build more resilient, inclusive, productive, and psychologically safe workplaces for the present and the future. Thank you for your time.
Michelle, thanks so much for that. I really do appreciate the evidence-based. I appreciate the provision of resources. They're very actually easy to find on your website, but I'm going to make sure that either through the Slido here or in our follow-up, we're going to get you some direct links. And I appreciate you speaking to the Mental Health Commission being an employer itself and what you've done with that. So thank you. And with that, it is now my pleasure to introduce our next panelist. Annie MARSOLAIS is the Chief Marketing Officer at BDC. She spearheads the development and execution of BDC's multi-channel marketing and client experience strategies across the country. She also oversees the brand strategy and reputation management and social impact at BDC, the Bank for Canadian Entrepreneurs. Her main focus is on service excellence so that Canadian SMEs have access and receive the support they need no matter how they choose to engage with BDC, whether it's online, via mobile devices, or in person. Ms. MARSOLAIS joined BDC in 2015 as Vice President of Marketing and Communications and has led a complete overhaul of the bank's image. She is also a mental health advocate and a big supporter of BDC's community investment program, which is Entrepreneurs Wellbeing. Annie, I'd like to welcome you to the floor. Thank you.
Thank you very much, Leah, and hi, everyone. It's a real pleasure to be with you today. So the topic of entrepreneurs' mental health strikes very close to home for us at BDC as Canada's Bank for Entrepreneurs. We started looking into the topic in 2019, and with the help of the Canadian Mental Health Association, we conducted the first ever study on Canadian entrepreneurs' mental health. And at the time, the study confirmed that entrepreneurs face more mental health issues than the general population. And that was pre-COVID. So we decided to conduct a series of surveys on entrepreneurs' mental health and their coping strategies during the pandemic. So we've done 3 surveys so far, 2 last year, 1 in November and 1 in August, and 1 more recently in March, just before the 3rd wave. And in our research, what we are looking at more specifically are the sources of stress for entrepreneurs, anxiety, loss of control, burnout, depression. So different mental health conditions that can impact the ability to work or the productivity at work. So today I'll speak about some of the entrepreneurs' mental health patterns that we've seen across our research, their coping strategies, and a specific focus on women entrepreneurs. So looking across the 3 different COVID surveys, here's what we saw. So first, not surprisingly, it's similar to that of the general population, the yo-yo effect. So as the COVID cases were rising and falling, so did the entrepreneurs' mental health and their mindset. And so, for example, our 3rd survey of this March found that 2/3 of entrepreneurs felt that they were back in control and they were overall satisfied with the mental health. The cases were going down, the vaccination campaign was picking up, and so we were seeing light at the end of the tunnel. And that's a strike contrast with the past November, just before entering the 2nd wave, just before winter. And so that was 57% of entrepreneurs feeling in control. So the situation is more positive, as in improving as the economy reopens as well. So the second trend that we've observed, and it's no surprise, cash flow remains the #1 source of stress. They need to pay employees, vendors, equipment. So when the COVID crisis hit last year, a lot of entrepreneurs were caught off guard. And so their ability to pay was really put at a great expense to their survival. And now the survival of the business is also top of mind, especially in certain sectors. And on the personal front, what is an important source of stress that we've seen emerging this year is the concern about the health impact of the crisis on not only themselves, but on their family and their employees. So the 3rd segment, the 3rd survey results that we've seen over and over constantly in our report is that certain segments of the entrepreneurial landscape are facing more mental health issues than others. Think young entrepreneurs, startups, visible minorities, businesses who have not fully resumed their operations, and not surprisingly, and Michel has talked about it extensively, women entrepreneurs. So in the case of women entrepreneurs, they consistently reported much higher rates of stress than their male counterparts. And compared to men, women entrepreneurs face more disturbed sleep, feeling of uncertainty, inadequacy, burnout, and that was even before the pandemic. So that they had already a lot on their shoulders before the pandemic, and just the COVID just accelerated everything. And the potential explanations for that, Michel also talked about it, well, is the fact that they need to juggle with everything on top of running their business, and sometimes running their business from home with the kids, the family to take care of, and so on and so forth. Plus, we alluded to the fact that a lot of women entrepreneurs are in the hardest hit sectors of wellness, hospitality, and retail, and I'm sure Alana will be talking about that. And so, as someone puts it, women entrepreneurs face higher stress levels from more places. So, knowing that, it's really important to develop mechanism to gain back mental clarity and agility. So in terms of coping strategies, the surveyed entrepreneurs most often turn to exercise, like simple things, exercising, going for a walk. So that's half of them. 1 out of 2 entrepreneurs exercise to release some of the stress. And then it drops. So the second coping strategies, and it's only 1/3 of entrepreneurs, is talking to someone and leaning on personal relationships. And according to the expert, it's really too low. because speaking to someone, networking, getting out of isolation, especially when mental health challenges are starting to appear, is something that is really important, talking to someone. And the third coping strategies that we've seen, and it's also just 30% of entrepreneurs, is practicing gratitude, self-care. So that could take the form of meditation or yoga on these types of activities to be able to face the wave. So as part of our studies, we consulted a panel of experts to understand what else can entrepreneurs do to better cope with the mental health challenges. And one of the things that they said is it's fine to exercise and to go for a walk, but it's not enough, especially that we're faced with so many challenges at once. So they need to adopt more than one type of approach. So whether it's a combination of walking and meditation and so on and so forth. But what they say is, again, talking to someone doesn't have to be a professional, because we know that only 6% of entrepreneurs, they're consulting professional services. And that's compared to 20% of the general population. So there's still a huge stigma and sometimes shame that are facing entrepreneurs, and they're not wanting to go into a clinic. And we now know that there are some virtual tools, or there are more means to access professional help. But that is something that the experts are saying entrepreneurs should do more. We know for a fact that entrepreneurs are very resilient, and so maximize the innate resilience in them. They have this strength that is a trait of entrepreneurs, part of their personality. So hang on to the faith that days will be better. Managing expectations. They carry the weight of the community, their employees, their business entirely on their shoulders. So managing the expectation, give themselves a little bit of room to breathe, is also important. The other recommendation, which I was quite surprised with initially, but through the participation of similar panels, more and more entrepreneurs have said that, is delegation. And it's funny to say that, but it's not something that comes naturally for entrepreneurs to delegate to others. But it's those who've done it. They turn around and they seek help from the people around them. First of all, the people around them want to help. They're just wanting to contribute and give a break to the business owner. And it really it's a life-changing, it's a game changer for entrepreneurs most of the time. So I will stop here, and I invite all listening, almost stop here, to visit bdc.ca/wellbeing, where we have regrouped some tools, references on well-being. And our ultimate goal at BDC is to raise awareness about mental health, and again, bring down stigma around it so that entrepreneurs can confidently talk about it, seek help without fear or shame. And I'd like to leave you with a quote from Marie Chevrier-Schwartz. She's a terrific women entrepreneur who has been very open about her burnout a few years ago. Marie is the founder and CEO of Sampler, a leading platform that helps deliver samples online. We are also proud to have Marie as an investee company through our Women in Tech Fund. Here's what Marie said in a heartfelt LinkedIn post last year. While I'm doing much better now and back to my usual self, I'm not immune to it happening again, and neither are you. I wanted to share my story because I feel a high level of responsibility for being real about what my journey's been like. It can be so detrimental to others when all we promote is our highs, but more importantly, when we unconsciously undermine others who might be having a harder time than us at that time. So I would like to salute all business owners who have the courage to speak about mental health as their own story, and the Canadian Chamber of Commerce for talking about it. Experiencing mental health issues is not a sign of weakness. It can happen to anyone, and talking a bit about it, it brings down stigma and can help others. So thank you.
Annie, thank you so much for that. I, for one, after this pandemic, if I never see a yo-yo or a roller coaster or a light at the end of the tunnel, I will be very grateful. And I think what was very poignant about what you said is the burden, right? Not only as the individual, but with the family, with employees as well, but also really appreciate that coping mechanism piece, the research that's evidence-based and that multifaceted approach is really great. And again, I took down the website details, and we'll make sure that gets out to all participants in follow-up. It is now my pleasure to invite our next panelist to the stage. RHONDA KLOSLER is the National Chief Operating Officer at RSM Canada. She oversees the firm's finance, human resources, and growth initiatives. In addition, RHONDA leads the Toronto office in her role as office managing partner and executes the firm's growth plans in the Toronto market. RHONDA is a graduate of Brock University and a CA, having earned her designation in 1993. That same year, she joined the predecessor firm and was made partner in 2001. In 2012, RHONDA completed the Harvard Business School's Professional Services Program, and there's a whole bunch of accolades here, RHONDA. I can't do them all justice, but she's currently serving on the Board of Governors of Junior Achievement of Central Ontario, and she's an advisor and contributor to the Faculty of Business at Brock University. RHONDA, I invite you to take the floor, and very interested in learning about RSM's Canada's work, resources, and thoughts. Thank you.
Thanks, Leah, for that introduction, and I'm delighted to be here today and to be part of this really important discussion. And I guess I'll preface to those details in addition to what Leah said. I am also the mother of 2 boys. My husband and I are both working from home and have been for the last 16 months. So we are all living this struggle together. I also wanted to share that today I'll just be sharing some insights and practices, and really from an employer's perspective. And you'll hear many similar themes to what you've heard Annie and Michelle reference as well. Again, RSM is an accounting firm. We're certainly not mental health experts in any way, shape, or form. So how we've approached mental health in the workplace, and in particular the last 16 months, is with a focus on the well-being of our people, living the values of our culture, which is based in caring. I would say that our culture at RSM is what makes us different, firmly focused on our people, their experiences, and rooted in what we call the 5 C's, which are caring, being courageous, collaborative, curious, and critical thinking with each other, but also with our clients. But certainly as the pandemic has worn on, it's amplified the need for our own commitment to demonstrate caring for each other. And in terms of our approach, it certainly started early on. There was so much uncertainty and stress in work, in our personal lives, and really all of that challenging our mental health. And in the early days, we erred on the side of transparency and openness. Even if we did not know the answers, and certainly there were lots of times and occasions where we did not know, we were open in saying that we were doing our best, asking for patience with our employees when uncertainties took us in a different direction. What we did communicate early on was that we would take care of our people. We would put the safety of our people first. We would do our best to ensure their job security, and there were a lot of questions in the early days around security. We would ensure compensation reviews and bonus payouts at the expense of owners, which I'm delighted to be able to say 16 months later we were able to do. But of course, as time pushed on, we found our people continuing to struggle with all the balances and demands of work and personal commitments, remote working, and all of that, all that went along with the transition to remote working. Homeschooling, caring for elder parents, and now what returning to the workplace will look like creates additional challenges. And it's frankly just the uncertainties of every day of the past 16 months. And we all understand that for the most part, an inordinate amount of that additional burden, as has been shared this afternoon, fell to women. And as if a global pandemic was not enough, there's been so many other challenges around racism, terrible acts of violence in our communities and against members of our communities. I mean, it's just been, I look forward to looking back in time and on this and how it's really made us so much more resilient. So although a challenge, it certainly I look at it as an opportunity. It gave me a tremendous opportunity to personally lean into my strengths and values, empathy, transparency, honesty, and genuine caring for our employees to shape a better workplace. I became super focused and intentional. I've been accused of using the word intentional too much over the last 16 months, but I felt like it was important being super intentional on connecting with our people and asking our leadership and staff to do the same. Connect with people, check in, see how they're doing, and really listen to the responses, not just a glorified, or gloss over the answer. In doing that, we heard the real struggle of our people. And I'd share that that the pandemic has also allowed us or presented an opportunity for us to normalize conversations around mental health and talking about our feelings in the workplace. None of us are mental health experts, as I referenced, but we wanted our people to feel comfortable raising their concerns and how they were feeling. So as leaders, we were open and transparent, sharing our own experiences, creating a forum where people felt like it was safe to discuss how they were doing. Of course, it has to be more than words, as we've heard. Our people need to trust that the caring was authentic, and that it was reinforced, and that was reinforced through our consistency in our action and the support we put in place. We've encouraged our people to bring their whole selves to the workplace, share their struggles, successes, what's important to them. And they've been able to do that both in informal conversations, but also in more formalized, organized events that we've held. Flexibility has been key, particularly for women during and will be as we continue to look forward into returning to the workplace, whatever that might look like. And as I said, our priority has always been on our people, something I'm extremely proud of, and it really does drive our culture at RSM. So what have we done? And certainly these are just some practices RSM has put in place, but I share them and hope that some of the employers in the audience today can take them away. But as I mentioned, a big part of it was around flexibility, empowering our people to do what had to be done at a time that works for them and trusting that the work would get done. And it did. Here we are 16 months later. We also made significant investments in support for mental wellness, including moving to an online platform where we could provide immediate mobile support to our people through one-on-one coaching. The app is called Modern Health, as well as circle group discussions that people could participate in on a number of relevant topics. And that was made available to family members, not just our team members. So we also implemented weekly mental health check-ins with a mental health expert, so people have the opportunity to hear best practices around managing how they're feeling, as well as to ask questions. As I said, flexibility, accommodation, connecting with employees, really, and asking what they need from us as their employer. We had a focus on working mothers to really work with them to find solutions that would work for them and their families, including, as I said, flex work arrangements, working from remote locations. In some cases, we had employees relocate so they were closer to their family members. So just supporting all of those different accommodations, providing additional benefits that supported families. So we introduced emergency child and elder care options as part of our standard benefits. We provided additional vacation days and office closures to encourage people to take some downtime. We also implemented family gifts where we would we had delivered to each staff member barbecue baskets or holiday baskets, and we encouraged people to share pictures of them sharing the food together. Just again, another opportunity to engage. I personally share weekly mental health minutes by email that are just quick, easy tips for people to leverage. For example, how to recognize or prevent burnout at RSM, how to ask for help, practical tips on calendar management and carving out time in your calendar to create flow time or time to think, and frankly, just to get away from the back-to-back video calls. We've also implemented Brownout Fridays, where we have eliminated internal meetings, as well as video-free Wednesday afternoons. Don't ask why Wednesday afternoon, I have no idea. All with a focus on reducing some of that strain on the back-to-back video WebEx and Zoom calls, recognizing that type of engagement nonstop is also creating stresses. We shortened our standard meeting times from 30 minutes to 25 minutes and 60 minutes to 50 minutes to allow a break between calls and as silly as it sounds, just even an opportunity to grab a snack or a glass of water or use the washroom. We empowered our people to say no to meeting invites, and if they felt that that was not the best use of their time. And as leaders, and this is an important one, we led by example, recognizing people would follow our lead. We've engaged external speakers who spoke to our owner and leadership group on workplace exhaustion, where we talked about how we have exhausted leaders leading exhausted teams and how to manage through that. And the individual, her name is Jennifer Moss, outstanding. She's Canadian and just an incredible speaker. She shared practical tips on self-care and managing workplace stresses. We've also engaged in more formal activities. We call them courageous conversations, where people share stories on personal and relevant topics such as mental wellness and anxiety issues, systemic racism, balancing work and family life. We've had a family psychologist speak about the stresses families are feeling at this point. Through all of it, we were and are trying to create a place that encourages, again, people to be their authentic selves and feel it's safe to have these conversations. Stewardship has always been key at RSM, and it's important we continue to engage our people to give back to our communities that we work in. And we've held a number of different activities throughout the past year and a half. But really what we heard from our staff is we asked if we should back away from some of those activities, realizing it was another pressure on them. But what we heard from our people was that their involvement in these non-work events really was a saving grace and created an opportunity for them to engage and in dialogue outside of the normal work discussions that would take place. So in fact, we held as many different activities as we have in the past. So again, these are just some of the things that we've focused on, but I do think from my lens, and I've spent a lot of time reflecting over the last 16 months, is the absolute most impactful thing we did as an employer was to make it safe for our people to talk about how they were feeling and really listen to them, and then try to support them as best we could, recognizing we are still running a business. But the normalization of having conversations around mental wellness in the workplace was absolutely the most impactful thing we've done, I believe. So just a few thoughts and hopefully some tips for people to take away.
Rhonda, I can't thank you enough for that. And I don't think anyone could ever say that you can use the term attentional too much. But from an employer perspective, really appreciate you talking about that journey, but have come to a multitude of really concrete examples. And as you said, creating a safe space and first and foremost, making, putting it at the forefront is fantastic. So thank you for that perspective. Very much appreciated. I'd now like to welcome our fourth speaker, and I'm delighted that she's here today. ALANA Baker is the Vice President of Policy and Public Affairs at the Hotel Association of Canada. She joined as the Director of Government Relations in the spring of 2017 to further develop its growing advocacy portfolio, advancing the interests of the association members with federal, provincial, and municipal governments. An award-winning government relations, public relations, and communications professional. She has over 14 years of experience and a proven track record on executing high-impact advocacy and public relations campaigns. As a consultant, ALANA has provided public affairs advice to clients throughout North America, and in 2010, she was selected by Manhattan-based publication PR News as one of the top 15 to watch in recognition of her outstanding contributions to the public relations field. She's going to speak to the experience of her members and their employees in the hotel sector, alongside efforts, ideas, and supports. ALANA, the floor is yours. Thank you.
Thank you so much, Leah, for the kind introduction, and good afternoon, everyone. I'm so delighted to be here with you all today. When I got the call about this opportunity, it was honestly a no-brainer for me. This is such an incredibly important dialogue to be having, and I want to say congratulations to the Canadian Chamber of Commerce for putting on such a fantastic event, and to all of today's speakers and my fellow panelists for their insights and their great work. When I say it was a no-brainer for me, I mean that both on a personal level and on a professional level. A quick personal story. Over the past year, I have learned so much about myself, about my own mental health, and can truly say that I have grown so much. As we all know, living through a global pandemic is certainly not easy. Compounded with the recent loss of my mother and going through an unimaginable grief days before we all went into lockdown, attempting to single parent and virtual homeschool a 4 and 5-year-old while my husband worked outside of the home as an essential worker, caring for my elderly father, and working alongside my team around the clock, fighting for survival for our hardest hit sector that was completely decimated, I was having a very tough time. But with the support of incredible family, friends, mentors, colleagues, business leaders, and health professionals, I learned that it is okay to be gracious with yourself and to take care of you first. After learning that sometimes the hardest decision you have to make is the best one, I made the difficult but necessary decision to step away for a temporary leave of absence. And I came back healthier and stronger. And what's more, as I started to tell my story and talk about it more, it was truly eye-opening how many people thanked me for talking about it because they were going through their own personal struggles and were comforted by the realization that they were not alone. Speaking with one of my members recently, she said something that really resonated. And that is that one of the reasons she spearheaded a number of resources and supports for their employees and others within the sector was because she wanted to make sure that they didn't feel as though they were alone, a sentiment that many likely know all too well. For the accommodation sector who I represent, our employees, predominantly women, youth, and immigrants, are the heart of our hotels. What's more, the majority of our industry is comprised of small and medium-sized businesses. These are individuals from within our own communities who have invested their livelihoods into our hotels. And what makes our sector unique is that our employees pride themselves on taking care of others. It's just in their nature, ensuring that their guests are comfortable, that they are safe and looked after at all times. So I don't think it comes as a surprise that it's easy for some, particularly women, to be so focused on taking care of others that they may forget to take care of themselves. The most heartbreaking impacts of COVID-19 in our sector are the impacts on our employees. From worries about job and financial security and layoffs, to the risks of stress and burnout due to overwork and trying to manage everything at home, we've seen it all. At the height of the pandemic, with necessary public health restrictions in place, travel effectively came to a halt. This means with no revenues coming in and hotels having to make the most difficult decisions on whether or not they will have to shut their doors for good. Unfortunately, many of our employees had to be laid off or furloughed. Many were left wondering, how will I take care of my family? How will I put food on the table and clothes on their backs? How on earth are we going to make it through this? Our members have recognized the many impacts on their employees and have come together to embrace mental health during COVID-19, now more than ever. One member I spoke to revealed that 94% of those within their own membership said that they were concerned about the mental health of their workers. 94%. I am proud to say that our members have not only recognized this crisis, but have taken action and have implemented several resources, initiatives, and efforts to support their employees, whether they are active or inactive staff, as we all try to make our way through this pandemic. I'd like to highlight just a handful of those programs and supports that are being offered. This list is not exhaustive, and if we had more time, we could certainly explore all the resources out there for hours on end, I'm sure. What's been made clear for me is when you're talking about mental health, there are a number of aspects that can be associated with it. It is certainly not a one-size-fits-all approach. Take Marriott's Take Care Wellbeing program as an example. Through this program, they are committed to promoting opportunity, community, and purpose for all. And this extends to all aspects of an associate's life, including emotional, physical, financial, and career well-being. Through the program, associates are provided with the necessary resources so that they can thrive, even during difficult times like this. I talked about the impacts on families earlier and the significant weight that many women in our sector feel on their shoulders. A number of our members, including Sandman, Hilton, IHG, and others, offer employee and family assistance programs. These programs are available free of charge to all employees, regardless of how long they've been with the company, recognizing that personal difficulties such as anxiety, depression, family struggles, and mental health issues may adversely affect their employees, their performance at work, and their health or personal relationships. Many of these services provide 24/7 access to professional consultation, short-term counseling, and other services via telephone or the internet. More flexible work schedules have also been implemented to support teams during this time. What's also been great to see is supports are being offered to employees whether they are active, on furlough, or on leave. Our members are doing all they can to support them through a number of different initiatives. Some examples include ensuring there's a mental health focus on all regular team meetings, regular communication updates on the health of the business, partnering with other large employers to provide short-term employment opportunities for associates needing work now, providing crucial and no-cost mental health resources to support associates during this difficult time from a physical, mental, and financial health perspective, and continuing to provide health benefits to associates, even those on temporary layoff, so that they have access to the best care possible during this crucial time period. Asking for help can be hard for some people, and it might be hard to admit that you are struggling. It may also be hard because you might not know how to ask or who or where to turn to for help. Choosing someone you trust is a great first step, and there are also different avenues of support available. Some of these can also include preventative and proactive support measures, and many in our industry offer such programs. Some examples include a women's leadership circle, where on a monthly basis, female leaders invite employees to have an hour-long chat during which they have a very open and frank discussion about any types of struggles, be it personal as well as professional. One member told me that she personally benefited immensely from participating in these sessions, knowing that she is not the only person feeling the way she is right now. It is a genuine source of support for her, and in a time when we don't often see our colleagues, it has in a way brought them all closer together. Another example includes wellness sessions, which are led by an expert speaker who offers guidance on navigating through the pandemic, covering topics such as mental health and resiliency, leading in times of crisis, championing ourselves, and goal setting and positive thinking. And finally, leadership update sessions, which are monthly sessions that offers employee teams the opportunity to hear directly from the presidents and C-suite executives within the organization with regards to how they will be supported through the pandemic and also help them envision life post-COVID. Lastly, we have also seen many resources and supports available through our provincial and regional associations, some of whom have partnered with other mental health organizations. Online portals for mental health and wellness resources, specifically for the tourism and hospitality industry, are available, including training, coaching, support and discussion groups, free internet-based therapy programs, and other resources. So I think I'll stop there for now. Like I said, I'm sure this is a topic that we could cover for hours. Just one last thing, given the topic of today's summit, I would be remiss if I didn't share that the Hotel Association of Canada is proud to put diversity, gender equality, women's advancement, and representation in leadership at the forefront of our business practices. In 2020, our association met the goal outlined in its diversity policy to reach at least 20% female representation by 2020, and increased its goal, pledging to increase the overall proportion of board seats and executive officer positions held by women to 30% or greater by 2022. I am pleased to share today that this goal was met 1 year early, an important milestone for the governance of the association. So I will end today with a message to everyone out there who may feel as though they are alone. You are not alone. We see you and we hear you. And in the words of my colleagues in Ontario and their Hospitality Stay Strong initiative, we stand united with you. Times are tough, but we are tougher. You matter, and so does your mental health. Thank you.
Alana, thanks so much for that, sharing the stories of the employees within your sector, the strong examples of your members and what they're doing, and as well as your personal story as well. And as is inevitable, folks, with any of these sessions, we could do all-day summits on each of our sessions, and we're going to run out of time sooner rather than later. I want to acknowledge that we do have a running list of questions coming through, and thank everyone for them. They're talking about, entrepreneurs or, businesses who don't have EAP programs, what they can be doing from the individual point of view. How do you express your mental health concerns with agency, what we can do for those women with the domestic burdens as well. but we do have time for one question. I'm going to name it and then ask if each of you here. I'll call you out in order to respond. But the question is what is your hope for the mental health ecosystem and all of us in it coming out of this pandemic? Rhonda, I'm going to start with you on that question. Thanks.
Sure. Thanks, Leah. And again, great question. I guess from my lens is it was in my closing remarks, but it's really my hope looking forward is that we've removed some of the stigma and people, as we're looking forward, we can kind of take some of the learnings we've had over the last 16 months and apply them and continue to apply them as we move forward and really encourage our employees and our leaders to engage in these conversations openly so that people feel comfortable sharing. That's really my hope.
Rhonda, thank you very much for that. Annie, I'm going to ask you the same question now as well. What would be your hope for the mental health ecosystem coming out of this pandemic? Thanks.
I think in his early comments, Michel alluded to the fact that the next pandemic is that of mental health. So hopefully by having these discussions, we will ease. I don't think we can solve for it, but at least if we're opening the dialogue, we can make a difference. So, and talking about it, the general population, I think we've made great progress. With regards to the entrepreneurial ecosystem and community, there's a lot of work that still needs to happen. And hopefully the younger generations of entrepreneurs who are more attuned to taking care of themselves will lead the way, pave the way to have a more open dialogue about entrepreneurs' mental health. Thank you.
Annie, thank you for that. Alana, I'm going to ask you what your wish for the mental health ecosystem coming out of the pandemic would be.
Sure. Thank you, Leah. I mean, I will say it again. My hope is that, everyone realizes that they are not alone and there are other folks out there who are, experiencing similar struggles and that there are supports available. Annie just alluded to this as well, but I think the most important thing we can do for our mental health is to make sure that we're also taking care of our physical health. Mental health is physical health. So maintaining, a healthy lifestyle, focusing on maintaining a healthy diet, getting plenty of exercise, getting sleep, and learning to, looking forward to opportunities, the resources that are out there. The resources are there, and there are people there that you can speak to know that those help, support systems are available. So my hope is that people realize that there is a strong support system around them. Build a network of people you trust, and we will get to the other side.
Alana, thank you so much for that. And Michelle, I'm going to give you the final word from the panelists. What's your hope for the mental health ecosystem as we come out of this pandemic?
Thank you for that great question, Leah. I'll say thank you, Alana, for really generously sharing your story. Those are so impactful. So thank you for sharing that with us. I think my hope is that now that the pandemic has shone a really bright light into so many of the gaps that exist in our mental health system, my hope is that we can move at a very rapid pace to close that gap. We know that the impact of the pandemic will be long-lasting, complex. People will need services and they can't be put on wait lists. So we need to address that head on. Then I think the rapid upscaling of virtual care, e-mental health technologies is really key. And that includes the federal government's Wellness Together Canada portal. And if there's one bit of advice for people who don't have an EAP, who are looking for services, Wellness Together Canada portal offers various levels of services in French, in English, including direct psychotherapies. So it's really a great portal, a great service, evidence-based. Encourage you to take advantage of it. We've learned around a lot. We pivoted, there's that word, into virtual care, e-mental health. We need to hardwire those new initiatives into our system so that people have a better access to mental health services which we all need. So thank you for that. Thank you so much for putting this conversation and for inviting us to participate.
And thank you. We couldn't have gotten through a panel without the word pivot, I don't think. So that's yeah. And now I'm gonna, how do you wrap up a panel like this? There's so many key learnings and thoughts, but I think that the fact that there are key learning and thoughts, and this is on the agenda, is fantastic. And thanks to all our panelists here this afternoon.